to the panel. Oh, how lovely to see you all. You know when you've been planning a panel for a while and then it happens, people turn up, it's just a marvellous thing. So for those of you that don't know me, my name is Sally Uren. I am CEO of Forum for the Future. Forum is a sustainability non-profit. We operate here in the US, in Europe, in India and Singapore. We're quite small, but our mission is big. It is to accelerate transformation towards, we used to say a sustainable future, we now talk about a just and regenerative future. I'm also the co-director of the Climate and Health Coalition, which is why we are here today. So just before I introduce the panelists, what we're trying to do today is a couple of things. We really want to bring to life the work of the coalition, share some examples of what all these wonderful people are doing in the climate and health space. We want to engage with you all as stakeholders in the climate and health ecosystem. And we'll also be looking forward to the road to COP28, where for the very first time there is a health day. Such is the progress that has been made over the last few years. So let me just introduce my panelists. We've had Adriana from Bristol Myers Squibb, Terry Ling from Haleon, David Croft from Reckitt, John Wu from Kaiser Permanente. Then we have Glyn Richards from Bupa. And right at the end, so far away, we have Gary Cohen from Healthcare Without Harm. Thank you all for joining me today. Just before I move into the questions, just a little bit about the coalition. We formed the coalition back in 2021, which formalised some work that some of us were already doing in the climate and health space. The purpose of the coalition is very simple but very ambitious. It's to mobilise the private sector to take action at the intersection of climate and health. And on the panel today, you have the core partners of Bristol Myers Squibb, Haleon, Reckitt, Bupa. We also have core partners in the form of Walgreens Boots Alliance who aren't here. And I can announce a new partner as of last Friday, Bayer Health. So that's one of the things that we'll be touching on today. We want to build out the coalition because as the awareness of climate and health has really increased, and it is amazing to see it popping up on so many agendas in Climate Week, we now need to enable the private sector to take action, and that is what this coalition is all about. But we can't do that on our own, and so what we've been also wanting to do is to build out what we're calling our associate partners within the coalition. In order for the private sector to really drive transformational change, we need the broader ecosystem to move. And two of our newest associate partners are in the shape of Kaiser Permanente and Healthcare Without Harm. And we've got a present for you. Don't say we're nothing if not generous at Forum for the Future. On your seat is a map of the climate and health ecosystem, according to different levers for change. So you can see many of the organisations in the room today are associate partners, but what we're really wanting to do within the Climate and Health Coalition is to create that connected tissue between private sector actors, non-private sector actors in climate and health, because this is a systemic challenge. We'll need a systemic perspective, and so building that connectivity in this ecosystem is super important for us. So please, love it. Maybe make a spare one and give it to a friend. So that is that. Enough from me. So we wanted to bring this intersection of climate and health to life. And my first question is to the four core partners represented here on the panel. So let's go to Adriana and then Terry, then David and Glyn. Otherwise, I might get confused. But it's the same question. Just a couple of minutes, if you will, on what are you doing in climate and health? If you can bring to life the work you're doing in climate and health, that would be amazing. Adriana.
Yes. Thank you, Sally. And I am delighted to be here, really excited to be a part of Climate Week. I am part of Bristol Myers Squibb. We are a new part of the coalition, so the newest member. So I think we're a bit more junior in our journey. I am going to share three things that we're doing. We're doing a lot. We need to do a lot more. The first is the removal of paper inserts from one of our marketed products. So the patient information leaflets that go into marketed products, they create a tremendous amount of waste. Unfortunately, in a lot of the world, they're required. The regulatory domain requires them. But in Canada, we were able to remove the paper from one of our products. And the product information is now on bms.com. I got a statistic that in a 3-year period, more than 20 changes are typically required in patient information leaflets. And with those changes, you then need to recreate the packaging, And oftentimes also the patient information leaflets are translated into multiple languages, which requires a bigger box. So there's a tremendous amount of waste savings in that. So that's the first one. The second one is that we just partnered with My Green Lab. They're also an associate partner of the coalition. And we are weaving environmental sustainability through the day-to-day operations of our laboratory spaces and helping to enable our scientists to think about environmental sustainability. And I think it's really important to note that this is a partnership, right? We sponsor My Green Lab. We couldn't do the work without them. And we've seen incredible progress already in enabling our scientists to consider waste, water, and energy in their day-to-day practices. So that's been really cool to watch. We're also, in partnering with My Green Lab, starting to consider suppliers and the green products that they can provide to our scientists. So lab consumables are a huge piece of waste, and the laboratory environment produces a tremendous amount of waste. If we can partner with suppliers that have closed loop recycling, for example, and have some consumables that are available to our scientists like that, it will be a huge win for the company. So that's the second. The third one, quickly, and then I'll hand it over, is we're part of the Pistoia Alliance, and we're specifically focused in that alliance on understanding the carbon footprint of clinical trials. I think this is a huge gap for our industry in particular, so we're starting to map out the clinical trial footprint. We're looking at decentralized trials versus traditional trials. So those are the three things that I wanted to highlight today. I'll hand it over.
Thank you. Just before you do that, I just wanted to say you're not the newest member of the coalition.
True.
That is Bayer, so Bayer Healthcare.
Thank you, Sally.
No, I just wanted to be clear about that. So, yeah, you're nearly new, but not quite so new.
Yeah.
The other thing I wanted to mention is what you're about to hear when we're bringing the activity of climate and health to life is examples that we've pulled together in our guidance document. So we've published 2 guidance documents through the coalition, which is guidance for all private sector actors with a specific focus on healthcare, food, tech and built environment for you to take action in this space. So please take a look at our website, download the guidance, more on what we're going to do with the guidance in a little while. But Terry, would you bring this climate and health wondrous thing to life, please?
Absolutely. So I'm representing Haleon. Our relationship with you is longer than us standing as a company. Haleon is the consumer goods, what used to be a part of GSK. And our core mission is better everyday health with humanity. And one of the ways we're bringing that to life in our strategy is we're addressing the social and environmental barriers to people achieving that better everyday health. And I think we'd all agree that climate change, air pollution are things that are affecting people not in their long-term health, but also in their very much everyday existence. So we're really permeating that through our brands and through our communication with consumers. But of course, you can't beat that drum unless you're also doing the things at home to make sure that you're not impacting the environment. And so we've been working very hard on our own scope 1 and 2 emissions. We have a goal to get to 95% of that being mitigated by 2030, and we're at 41% mitigation at this point. So very active in our own manufacturing space to do that. But we're also really now stepping up our relationships in the ecosystem because most of our scope 3 is going to come from our suppliers. And so we're working with people like Manufacture 2030 and other groups. So it's all about getting our voices all together and asking for the same things, because as one individual manufacturer, we can't go to our thousands of suppliers and say, oh, by the way, can you go to renewables? It's got to be everybody together, asking for these things. So it's a combination of us doing our homework and getting our own environmental footprint down, us working in the areas of health inclusivity and in health literacy, because if people don't recognize and understand how the climate change, how these natural disasters are impacting their own health, they can't advocate for themselves. And many times people who are not well included in the social networks are also not well understanding what they need to do to advocate for their own health. So for us, it's also really important. We have a voice in the communities. We have a voice through our ecosystem of suppliers, of vendors, of retailers we work with, and our own employees. If we can get that out there through our brands and through our corporate work, helping people understand this health-climate connection, then they can be advocating for themselves. And we've done a lot of work with The Economist. We have a health inclusivity index. And what we find is the outcomes, health outcomes, are most closely associated with people's feeling of agency in their own health outcomes. So if people can get that understanding, that movement to action, have that agency, that actually leads to the best health outcomes in general.
Great, thank you. And that's certainly one of the ambitions behind the coalition, is to create that collective ask of what we need from policymakers and so on. And I know we'll touch on the community perspective as we go through this conversation. So thank you very much, Terry. David, bring this to life from the Reckitt point of view, if you would.
Morning, everybody. I think, Reckitt's journey, and those of you who don't know Reckitt as a company, you will know, if you're in the US, you'll know Lysol. If you're in Europe, you'll know Dettol. Let's just leave it at that in terms of how the health impact of climate change is starting to affect us. We've been on this journey in a significant way, I would say, in the last 3 years or so. And for Reckitt, the climate and health nexus is absolutely core to the overall business agenda. Our brands, whether they're hygiene related or health related, are focused on helping people live cleaner, healthier lives, but in terms of tackling problems that they face day in, day out. And what we've seen in the last 3 or 4 years is absolutely testament to that. In the run-up to COP in Glasgow, we did a lot of research into what those new health implications are going to be. And since then, we've been looking at whether people understand how to mitigate or adapt to them, and the short answer is no, they don't. And now we start to see, along with how we mitigate our own impact on the planet, both in terms of climate change and in terms of ecosystems and biodiversity, the necessity of thinking across the whole aspect of our value chain, from where we source raw materials, the communities that are part of the river basin catchments that serve our factories, what the factories do themselves, but all the way down to our brands, becomes really critical in trying to help people have more awareness of that climate and health nexus. But then, through our brands, through better health literacy, through the work that we do, for example, in supporting better water resources, to help them to mitigate and adapt to those challenges. Let me bring that to life with water, because that's the best and most pressing example, I think. In India, we have a number of factories that are in water-stressed areas. The biggest decision we make if we think about a new site is there going to be water there in the next 25 years to run that site and for people to use the products? We've done work on catchment areas, which has restored water levels for village communities, bringing borehole levels up by about 7 meters with very simple engineering works. The factory is water positive in terms of no longer abstracting, in terms of balancing between what it harvests and what it supports and recycles. It's zero liquid discharge. But then downstream, brands like Dettol and Harpic are working through a program called Benegas Watch, which brings sanitation and hygiene standards and health awareness to life. And for a number of days of the year, the only thing you can see on Indian TV, which has more channels than the US, I think, is just multiple conversations around how health and hygiene has to come to life to mitigate those water stress activities. And that helps people advocate and prepare themselves for the challenges that they face. But it's not just India. We launched a program here only yesterday about water stress in the US. 40 out of 50 states in the US are approaching water stress. It is becoming the immediate pressing issue that we all have to be aware of, and whether that's through a brand like Dettol or Harpic, or a brand like in the US of Finish, helping to save water makes a big difference, and boosting awareness makes a big difference. And that then leads through to our advocacy work, and leading towards, and I'll stop at this point because we're going to talk about the road to COP very soon, but what we want out of the Health Day at COP, and how that impacts policy, and how that also is brought to life by what businesses, especially I think businesses, can bring to this agenda, which is what the coalition is all about.
Thank you, David, very much there. And so, Glyn, to you now. Again, bring this activity around climate health to life through the work of Bupa, if you wouldn't mind.
Sure, absolutely. So, hello everyone. Just a quick word on who Bupa is, because I'm conscious in the US market you may not actually have heard the brand. So, Bupa is an international healthcare company. We offer health funding, health provision, and aged care solutions for 43 million customers globally. That's delivered through 82,000 staff. And we have a purpose, which is essentially to help people live longer, healthier, happier lives, and to make a better world. Now, I think when we first started on the conversation and joined the coalition, the visitor, We recognise that actually, you simply cannot look after people's health, which has been our core focus for 76 years now, without also looking after the health of the environment and the planet. So that's where we started with our strategy and where we wanted to focus. And I think within that, we are very conscious that our health is being impacted adversely by our environment, but at the same time, healthcare is currently contributing to the problems we see in the environment. So there's a need for us as a healthcare provider to act, and so that's what we're doing. And
this is a good sign.
sorry, this is the greatest distraction I've ever had.
But Lynn, I think this means you're exuding.
Definitely a fan.
But this is authenticity. The dog is like, yeah, I'm with you so far. Keep going.
I'm going to try and keep myself on track.
This is what you get when you put dog biscuits in your pocket, isn't it? Come on.
So, trying to keep myself on message here. So I think we also realise that there is no net zero future without healthcare. We are always going to need healthcare, but the way we access healthcare has to change. It is currently not delivering the outcomes we need it to deliver in the long term. I think that's what we're really focused on at Bupa. So within that, I think we are really focusing on how do we deliver sustainable healthcare in a way that does not compromise patient care outcomes, because obviously we need to make sure that we are looking after patients' health needs. And I think within that, we have a big opportunity in the prevention space. So right now, we are treating illnesses as they arise. And what we're trying to do at Bupa is really focus on how do we sort of address those issues before they become particularly severe. How are we looking at chronic conditions? How are we looking at accessing customers digitally? How are we addressing sort of things like affordability and access issues within healthcare? And I think that's where a lot of our focus currently sits. We also want to empower people, similar to what we've heard already, around engaging their own health. How are our customers, how are our people thinking about looking after their own health actively? And we are trying to equip people with the tools that will allow them to do that, because obviously we understand that if you can look after your health actively, proactively, you're less likely to need the sort of more severe interventions later down the train. We also really want to simplify healthcare access, so we're looking at innovations, digital, and I have to say in the last couple of years has been particularly helpful in terms of rolling out digital to our customers and to our staff. And we also are looking at the minimizing the environmental impact of our care. So we've cut our own scope 1 and 2 carbon footprint by about 39% from our 2019 baseline. We're taking action across our scope 3 emissions as well. We are part of this coalition because we recognize that doing all this action individually is not enough. You have to take a system-wide, collaborative approach, and that's why I'm extremely proud to be sitting on this panel with these guys.
Thank you, and well done for coping with a very, very strong interest from our very friends. And I think, what I love about the work that you're doing at Bupa is that, as a healthcare company, you've really shone a light on the links between health and nature, and so you have a whole track of your strategy was about, it's called Regenerate, and I think that's just really brilliant. So hopefully just some examples of how the core partners are really activating in the climate and health space. As I said, there's a lot more in the guidance documents on the website. I'm now really wanting to sort of move the conversation onto our associate partners, if I may, and also just to say that there will at the end be an opportunity for questions. So I will come to you, just so you realise that. So one of the explicit objectives of the coalition has been to try and create this connectivity with the broader ecosystem. And one of the earliest organisations working in climate health is Healthcare Without Harm, represented here by Gary, who had the insight a long time ago that climate and health were inextricably related. And we're delighted to, as of Sunday, welcome Healthcare Without Harm as an associate partner into the Climate and Health Coalition, which I'm just super delighted about. And so, Gary, thank you for being here today. I wondered if you wouldn't mind saying a few words about Healthcare Without Harm, but also why you think mobilising the private sector is so important at this moment in time.
Sure. I'm glad to be here with all of you. Healthcare Without Harm has been working with the healthcare sector for the last 27 years to embed an environmental health and climate smart strategy into its core DNA. And so we work with hospitals and health professionals across 80 countries and with all the large UN agencies and health ministries to both model what that looks like and also to scale it across the world. So we think that the healthcare sector is actually one of the most critical sectors for the future of the planet in a climate stress world. Why is that? Well, first, healthcare is 5% of global emissions. So that's the equivalent of annual emissions of 400 coal-fired power plants. So we're actually, through the provision of healthcare, contributing to air pollution and to the cascading set of disasters that we're seeing around the world. The second is that, as we saw with COVID, healthcare sits at the epicenter of this collective trauma. As we see billions of people being affected by extreme heat and hurricanes and wildfires and all of those other biblical disasters, where do people turn to in those moments of crisis? They turn to healthcare. So it needs to be resilient in the face of what is happening and what is coming. And the third dimension is that healthcare professionals are the most trusted members of most of our societies. So how can we leverage healthcare professionals, healthcare companies, to help people understand the climate crisis as fundamentally a health crisis, a crisis of their fundamental rights around clean air and clean water and healthy food, safe housing. And so we've been trying to decarbonize the healthcare sector all around the world, focusing on the supply chain, which is the largest part of it, but renewable energy, anesthetic gases, food waste, plastics, energy use in MRI machines, all of that, pharmaceuticals, how to get healthcare to partner with communities to build resilience in their communities, to build health equity, to leverage their purchasing power to actually provide jobs and healthy supply chains, and also then to speak up. And this is a very powerful opportunity for the private sector to speak up about climate and health, because we have externalized the harm to people on the planet through an economy built on fossil fuels and toxic chemicals. We have to phase out fossil fuels as the greatest public health intervention we can make on the planet for health. And so who best to make those cases than health professionals and companies that are internalizing that reality? So I would say fundamentally what people want is they want an economy that is based on the Hippocratic Oath, to do no harm. How do we build an economy that is based on do no harm? And healthcare is the likely place to model what that looks like, to not run on fossil fuels, to phase out toxic chemicals, to support regenerative agriculture. So that's the vision that we hold, and that's the power of potentially this coalition and others like it that are finally coming to Jesus around the relationship between climate and health.
Thank you, Gary. And you did make me smile in an email you sent me over the summer, which was something along the lines of, yeah, it's great that after 20 years people have started to make the connections, a sort of resigned. So yeah, you saw it quite early on.
Well, we said that it took us 27 years to become an overnight sensation.
Well, and so we're really happy to have you here today in the capacity as an associate partner and also, the early mover in this space. There are other associate partners in the audience. I can see a couple. We have Health, Forecasting Healthy Future, WBCSD. Thank you again for coming along today. If I can now then move to John, you've been sitting there very patiently. So John is from Kaiser Permanente, and I would love to hear what you're doing on climate and health and why you've joined the Climate and Health Coalition as an associate partner.
Yeah, I think just take what Glenn said and what Gary said, and we're pretty much following that model and that approach. And for those of you who don't know, Kaiser Permanente is an integrated healthcare delivery system based here in the US. We serve across 8 markets or 8 regions across the United States here. But we have bigger aspirations to kind of do a lot what Gary talks about in terms of using our voice and our platform when we can. And I think our approach, very similar to what's been said, is, as we discovered 15, 20 years ago, everyone knew this intuitively, that your health is made up much more than the medical care and the insurance you have. and you all know about the social determinants of health, that all these other factors in your life shape your health just as much or even more so than patching you up or having a surgery or mammogram or a wellness check. Once we learned that, though, then kind of like what Glenn and Gary were saying, like, what do you do about it? And so on the climate front, it was sort of dual action, sort of the do no harm, like what are our sustainable operations? And then out in the community, going beyond do no harm, and how do we help build resilient communities and support, especially on the equity front, those who are most affected, who contribute probably the least to these issues. And then across both of those then is how do we take thought leadership opportunities, how do we build coalitions, how do we join coalitions, how do we learn about what we're doing internally and then what we're trying to do out in the community. So those kind of are the two prongs of our strategy, undergirded by this idea of we're going to have to amplify that work beyond just what we do. Examples of what we do internally for sustainable operations is everything that's been said. Similarly, around net zero, scopes 1, 2, and 3, working on supply chain. I think one thing example I'll highlight there is that, like I forgot who was saying that we can't just go to each individual company in our supply chain and ask for like a new contract that includes like lower emission product or that. So this over the last year, we've been working with about 20 other big health systems here in the U.S. and 20 giant supply vendors that we have, and said we should have this conversation all at once, and not we're all going to be coming to you, Johnson & Johnson and Merck and all these companies. So we're trying to get going here a supply chain coalition for health systems, and just kind of knock this out. Scope 3 is the biggest part of all of our emissions, so that's kind of a big deal. All the things around how do we inform our employees, how do we, our staff, and work on mobilizing our physicians and our nurses and all of our care providers as frontline champions and spokespeople and ambassadors to inform people about this. And so that's sort of on the operational side. On the community side, we've got a few things going. One example, I think there needs to be more understood between this climate and health connection. I think it's a little bit no duh, and 27 years later there is a connection, but I think for those who want to see more of the evidence and also want to see more evidence of what works for whom, like what does it mean to kind of mitigate in a community that's been underserved? What does it mean to that has certain truck routes through them that have been going that way for years to the port? Like what are interventions that are going to work? Green space, cooling centers, all those kinds of things. So we are working with the National Academy of Medicine here in the United States, and soon are going to launch a whole research sort of collaborative to understand what's out there already and put it into a repository that can be easily searchable, and then find out what are the gaps are in research and create sort of an agenda for research for the US so that funders, our national institutes of health, philanthropies, other private corporations can contribute to that so that we could drive more research and more evidence.
Great, and I'd love to hear more about that in a moment, actually, if I may. But thank you for making that connection, because it really does seem to me that health equity is climate justice. These are all part of the same issues. And the dog liked that too. So that's all good. Just before we move on to sort of where next with the coalition and some of our areas of focus, Gary, I'm very conscious that here on the panel we don't have that community voice directly represented. So if you wouldn't mind, I'd love to hear from you, because Healthcare Without Harm has done so much work in communities around the world. Could you just tell us a bit more about what communities want to see from the private sector? Because that obviously will inform the work that we do, and they're such a critical stakeholder in the work that we're pushing ahead with here.
People want basic things. They want healthy food, clean air, clean water, safe neighborhoods, safety in their communities. They don't want to have to be a PhD chemist to figure out what to buy for their kids that doesn't have toxic chemicals in it. I'll give you an example, though, that's interesting, that speaks to, it's a partnership that we've done with Kaiser Permanente and others in Oakland, the Bay Area on the West Coast. There's realized that between the universities and the hospitals in the region and the schools, that there's billions of dollars of purchasing power. So if you can aggregate that purchasing power and support more racially diverse and sustainable agriculture growers, you can provide guaranteed markets for them so that they know that they can grow pesticide-free, healthy food, and that food can then come into the hospitals, it can come into the universities, and it can come into the businesses in the area. And then as we're developing strategies around food as medicine for those who are food insecure or pre-diabetic, that same food can then be used to sort of provide to people to address their food insecurity or to be more preventative in terms of the obesity and diabetes and heart disease and all the other chronic diseases. So we've created this ecosystem in the Bay Area where that's exactly happening, that sustainable farmers are being rewarded and sourced with contracts to then bring into these hospitals and bring into the schools and bring into the universities. And it's starting to weave together a more climate-smart, regional, resilient food system in which food is seen as regenerative. Food is medicine. Food is economic development. Food is community. And so those kind of examples where there's partnership between healthcare leveraging all of its assets in community is an example, I think, where we can be replicating all over the world, not just around food, but around energy. How can we run our buildings not just for ourselves, but also microgrids for the community? And so many examples like that.
And that's in the guidance document, that's in the version we published at COP27. That's why we did a deep dive in terms of the guidance for the food system, for built environment, and also for tech, because along with healthcare, food, tech, built environment, disproportionately positive impacts on this whole area of climate and health, and it's very much part of the thinking going forward. On the note of going forward then, so we're 2 years in, we've published 2 sets of guidance. We'd like to feel, as a coalition, we've helped make the case for a health day at COP, and certainly there's increasing recognition of the links between climate and health. So I'd like to explore sort of what next to the coalition, if I may. And I think we've discussed as a coalition what next, and we think there's sort of 2 broad parts to the what next. Is accelerating the impact that these wonderful corporates have in the space of climate and health, and then there's also broadening out the membership to reflect that this is a systemic challenge and the food system is so linked to health, as we've just heard. So, Glyn, if I can go to you first, if I may. What's your vision for what next with the coalition?
It's not a small one. I think it's touched on things you've already said, Sally. I think it's about equipping, it's about shifting the whole healthcare sector. This is exactly why we've come across from, we are not the same businesses. We operate in different elements of the healthcare environment, and we deliberately collaborate across those because we recognize you have to look across the sector. You cannot simply sit in your lane and expect there to be this broader shift. You have to reach out. So collaboration across this sort of broader healthcare system is incredibly important. I think that's where this coalition has been incredibly powerful. So, first thing is really just, we're going after the whole healthcare sector. And I think we recognize that as a coalition, even now, we're still quite small, but we have this opportunity to bring new members in, to shape the sort of the conversation, to share the guidance and the experience that we've had, the failures and the successes. And I think that's exactly where we want to sort of go with the coalition. I mean, the other thing we do is we learn very actively from each other within the coalition. And I think that's been hugely powerful. So we started in this coalition a couple of years ago, and I think we've learned huge amounts just by interacting, with our colleagues across this table, as it were. So I think that's been hugely beneficial. And I think, I would encourage everybody, if you're not already in some kind of coalition with it that affects or is driving your sector, go and find one, set one up, because I think the reality is that is exactly how you're going to create that sort of cross-sectoral, cross sort of pathway change and drive that broader outcome. And then I think finally, really, that there's still this massive opportunity to continue to mobilize the private sector. Sally, you mentioned 2 publications around exactly gearing after that. It's going after the public sector, the sort of private sector, and mobilizing the private sector on climate action, recognizing the intersection between health and climate. It's still, whilst it's been recognized, I think it's still quite a new concept.
Yeah.
And it is being talked about more and more, but there is still a huge opportunity for that to really start to drive decision making. And that's not quite what we're seeing at a policy level, and it's also not quite what we're seeing in some of our private sector peers. So there's still plenty to go after in this space, and I think that's what's super exciting about this coalition is there's plenty more to go after.
Great, thank you very much, Glyn. David, what's your vision for what next with the coalition?
I think, there's a number of different things that I think the coalition can really lean into. And I think the starting point is, to Gary's point, 5% of the global carbon footprint comes from the healthcare sector. So it is a no-brainer that the healthcare sector has to decarbonise. That's a given. If we don't do that, we have no mandate to talk about anything else, if I'm brutally honest. So that just has to happen as fast as we can possibly can, upstream and downstream. But then, for me, the bigger impact that we create is by helping to mitigate the impacts that climate change is having on people's health all over the world. And as part of decarbonising the health sector or health service delivery, we work better to prevent some of those healthcare impacts. Prevention is better than cure, and prevention lowers the carbon footprint of the total sector as well. We haven't made that case strong enough, I don't think. And although at COP last year, I was with Mohammed Pateh, we were talking about how $1 spent on health gives you a $3 return economically. That discussion still is not to the fore, which I think is a miss. And for COP this year, I really want that discussion to come more importantly to the fore. And then thirdly, and this for me is the really big ticket, if I'm honest, climate change to many people is impersonal. It's a long way away. It's polar bears falling off melting ice floes. It's planetary. But it's not personal to you. And if it's not personal to you, your incentive to make behaviour changes that make a difference, it's hard. One thing we can do through the coalition, individually, collectively, I believe, is make certain that people start to understand the impacts that climate change is having to them on their day-to-day lives, to their family on their day-to-day lives. And then with that, hopefully they'll also make other changes that work at that planetary level as well. I think we, within the healthcare sector, have a huge potential to be a real actor for change on a wider basis, in a way that, if I'm honest, I'm not seeing enough coming through some of that government action. It's all too remote, and it needs to be personal if we're going to make change stick, and change stick quickly.
Great, thank you. And I think some of you were at the soft launch of a new partnership between Forecasting Healthy Futures and Time CO2. You're going to see more of this, but a very creative and vivid public-facing campaign to make those connections real. And that's certainly something we've really noticed through our work, is that health can give climate a very human face and therefore make it much more relatable. Thank you, David. Terry, your vision, what would you like to see happen next?
Yeah, I think about it as raising the ceiling and raising the floor, right? I think it's groups like this that are out in the forefront trying to break new ground, trying to get more insight and information so that we can tackle climate change. But we also need to leverage consumers, just citizens, right, to push for the policy to bring that floor up. Because as much as we may be pushing for, more innovation, for unique ways of doing things, if we don't get everyone acting that way through at least having policy securing the floor, it's going to be a really tough challenge. And I think that only happens through creating citizen advocates, through creating consumer advocates that understand why they need this to happen in their world. I think that's really important. And then in terms of pushing the forefront, we're members of many coalitions because there's many challenges out there. We have a coalition that's of manufacturers, 0-100, focusing on trying to get to a carbon neutral, and we've gotten a small group together and just said, let's tackle paper, because as you said, paper's a big thing, right? And as we started to share information, talk to suppliers as a unit, we looked at that whole supply chain. And when you look at all the different elements of the paper supply chain, there was like one massive point that just sucks all the carbon, right? It's just at that one moment when they're going through some kind of mill, that's the moment that all the carbon's happening, right? And once we collectively understood that, we're like, great, now we can go talk to these suppliers upstream and deal with that. So I think that sharing of knowledge in the innovation space is going to be really important for coalitions. No one company is going to be able to sustain going after all those different things, but if you come together with groups of common interest, figure that out and create the technology and innovation to after. So I think it's the raising the ceiling, but then we've got to get consumers, and it's all kinds of ways in which we can reach consumers. Our products reach consumers every day, all the time. So how can we get that messaging across with our own communication with consumers, that they understand how important the climate is, how important this is for their own health, how important clean air is for their own health. Get that out there as we're touching consumers, millions of times a day, right?
Great, thank you. And there's something really definitely interesting there, which is for the work of the coalition to both go deep. So you're all leading actors in the healthcare system. How might you go further and faster and really enable that positive contribution of healthcare? But also, how can we go wide? How do we get that activation across other systems as well? Thank you. So Adriana, I'd love to hear from you. Yeah. What do you think?
So I'm going to just build off of what Gary said. We are healthcare private leaders, and we certainly have a leadership role to play here. I think if we think we can do it alone, we are very misled and very misguided. As you consider climate change and the disproportionate impact that it has on the under-resourced, we need to start understanding that more so. We need to ensure all of those voices are at the table. But as private sector leaders, we need to start joining forces with other sectors, right? So IT is huge. Being able to innovate and leverage IT data, understanding the root cause of the issue, not just putting Band-Aids on mere solutions. Housing, infrastructure, Gary mentioned food. I think there's so much beauty here in starting to have this collective, excuse me, puppy, conversation. And that's where I think the true innovation lies. If we as healthcare leaders sit in a room together, we're gonna miss the mark, largely miss the mark. We need to get together, we need to raise the voices that have not been heard before, and we need to have that cross-sector, beautiful innovation, I think, to truly make a difference in this space.
Great, and that's for me why I think this whole area of regenerative agriculture is so interesting. Offers so much potential for multiple solutions in multiple systems. So John, you mentioned a little while ago this new collective that you are supporting at Kaiser Permanente. Would you tell us a bit more about that, please? I think you're launching it tomorrow?
Well, yeah, I mentioned the research one, which is going to go out soon. We looked around and said, the world doesn't have enough coalitions yet, so let's build another coalition. And it's similarly, I think, as much as, I mentioned our supply chain coalition that we want to get to, and that's very health systems working with their supply chain. We're part of another coalition that's cross-sectoral and sort of nationally focused. But then we were realizing that going beyond just the healthcare companies, that tech, food companies, retail, consumer good product company, and the community organizations somehow need to come together and focus on this idea of centering health as part of health and health equity as part of climate action. So this Thursday, we're going to have the first meeting of that group that's coming together. I think the key here is, you talk about the vision of this coalition, we're an associate member here, that how do these coalitions, we don't need to form a mega coalition, although maybe we could, but how do these coalitions stay aligned and complementary? It's okay, I think, that there's overlap too. And fundamentally, I think we're still at this moment of movement building. And I think it's okay that there are all these voices out here that saying at some point we'll reach a tipping point, and maybe we're kind of already there with the summer that we've had. So I think this new sort of like business, community, multi-sector coalition that we want to try, and we're working with the Business for Social Responsibility, BSR, to help us organize that. And going to lean probably on you all and the roads that you've already paved here to say, how do we think about health in this different way for these companies?
And I think, from what I understand about the collective, it is hugely complementary because you're really focusing on activating that community voice. And that's not an area that we've particularly explored. So I do see a lot of complementarity, which is great. Gary, 27 years on, what do you want to see from this coalition?
Yeah, so modeling the solutions you're all talking about, elevating those solutions for your competitors and others in the sector to say this can be done. It's good for the environment, it's good for people's health, it's good for the bottom line, it's good for the communities we serve. Just we need so many more examples all over the world that show where we're wanting to go and are multi-solving. So it's not just, we're not just decarbonizing the sector, we're trying to revision what healthcare means in the 21st century. And we're the first generation of health professionals and companies to realize that we have to operate at 3 scales: individual healing, community healing, and planetary healing. And that has to be embedded in our DNA going forward. And so if we can model that, wow, we're going to achieve a lot.
Yeah, I love that vision. Brilliant. We've got a few moments now if anyone has any questions for these wonderful people. We've got a roving mic. I can see it. Does anybody? Yes, it's going to be first come, first served. So I think we were here and then to the back. Yes, the lady. Yeah, you were just slightly ahead of the lady behind you.
Oh, yeah, it is. Hi, thanks. Great panel. Super interesting. And I wanted to talk a little bit about, or ask you a little bit about nature, because it's really health, nature, and climate. And you've alluded to it, and I think, Glenn, you talked about it specifically in planetary health, is about nature's health as well. So be really interested to hear your perspectives on what you think your sort of contributions and role is in the nature side of the equation. Thanks.
Great question. Just in the interest of time, will one of you take that? David, who's been sitting on the task force for nature-based something or another.
Nature-based.
TNFT, thank you. David!
The question about nature-related something or other is critical. Yesterday, New York Stock Exchange saw the launch of the TNFT guidance. And it was standing room only. There were 200 or 300 people there. I think that tells you there's a recognition that action on nature has to happen just as fast, if not faster, than some of the things we've spoken about today. Because it's clearly a facilitator of resilience and of impact, both for climate and for people's health. You know, the well-being that comes from nature, the social impact, the social value. And the sad fact is, everybody has been using natural assets forever and a day, but hasn't attached any great significant value to them. That has to change rapidly. And within the global value chains that companies like ours consider, we have to work very hard and think about how you build resilience and how you head towards a nature-positive conversation, and how you measure and how you disclose and how you demonstrate the difference that you are making. And I think we're going to do it faster in the private sector than some of the policy dynamic will generate. I'm hearing very encouraging noises from the stock markets about the level of interest. And that's why I think the launch yesterday with that level of audience was so significant. So watch this space, the guidance is out, encourage people to report, disclose, and describe what they're doing, and hold them to account for it.
But Helen, it's a great question, and just 2 builds. One of our associate partners in the coalition is WBCSD. They're actively exploring this intersection. And one of the year-end priorities for us within the coalition as we move towards COP is to take the guidance document that we published and turn it into a toolkit. And we want to use that to really amplify the intersectionality between nature, because it is sort of implicit, but we would like to make it more explicit. So great question. Terry,
one thing,
of course.
As a manufacturer who, most of the things that we use, that we actually purchase, are far, far away from their agricultural origin. So this is just crying out for technology solutions and very collaborative work, because we can't begin to get the transparency of where in the world some of these things are touching natural resources without that sort of mega technology, as well as just an open, transparent environment. So it's a great dilemma for many of us who want to act positively, and you've got just to bring heroic efforts to try to get to that transparency. So I think that's another thing that's got to develop with it, right?
And since the passage of the Paris Climate Treaty, there's been $5 trillion invested in fossil fuels. So nature is still externalized. It doesn't show up on the balance sheet of Exxon or Shell or BP. And so if it's not on the balance sheet, then it doesn't exist. And so to your point, that has to fundamentally shift. Because if we just don't count for it, then we are externalizing enormous harm to both nature and to everybody on the planet. It's so fundamental that has to shift. That economic model is so broken. We got to call it out.
Yeah, and there's a lot of exciting work happening in that space, and we think we need to broaden out that model for sure. Let's take one last question from the lady there. Yes. I'm conscious of time, and it's ticking away, and I know Solutions House has got a busy time schedule, so we've got 4 minutes left, everybody.
I'll try to make it very quick. For the first time, we will have a health day at COP28, which is a fantastic opportunity to make sure that the private sector is using its voice effectively. What explicit commitments do you think the private sector could make using the power of the coalition, and what accountability measures will you propose to make sure that we're not only talking the talk, we're walking the walk?
That's a brilliant challenge. I don't know if anyone wants to respond to that. I mean, just while you think about it, what we are working, so we've got 3 priorities with the coalition as we head towards the end of this year. One is to turn the guidance into an accessible toolkit that can be picked up by different business functions across the whole swathe of the private sector. The second is to really try and position the private sector as part of not just the health day, but the broader dialogue around climate and health at COP28. To be really honest, we haven't figured out totally what that looks like yet, but we want to make sure that the Climate Health Coalition really shines a light on the potential that the private sector can bring to this. And these organisations on the panel, they've already made great commitments. So I don't think we can be specific about the precise commitments right now, but know that that's one of the two of the 3 commitments for the rest of the year is really understanding how we show up at COP. We will be showing up at COP. And our third priority is to expand out the coalition. By the time we get to COP28, we'd love to be able to speak to other private sector members of the coalition outside of healthcare. So I'm not ducking your question. What I take from this is, as we think about how we show up at COP28, let's be clear about accountability and exactly what we're pledging to do. Did that buy anyone enough time?
I'll just add that one is it's important to make these commitments, and all these commitments are great net zero commitments and decarbonization commitments, and it's important to have transparency, to actually disclose what your emissions are and to show progress over time. That would be accountable to the larger community. The other thing that's going to be a conundrum at the COP is that the head of the COP is the president of the largest oil company in that country. And so there's an effort to try to let's not really talk about fossil fuels, let's talk about all these other great things. And if we miss the importance and the centrality of phasing out fossil fuels in an orderly way that with just transition to the communities that have been impacted, we're missing the boat.
Yes, and I don't think, and I might be going out on a limb here, but I don't think so. I don't think we'll be inviting the oil and gas sector into the coalition anytime soon. Sorry about that. So I think we are at time. Thank you all for joining us today. And I've noticed so many associate partners in the audience. Sorry if I haven't called you all out. Clean Air Fund is here as well. Hello, Sean. We really appreciate you coming along. We have sort of simulated the climate and health crisis a little bit because as the conversation's gone, it's got warmer and warmer. So I hope that you're okay. But we have had nature on the stage. Yes. So we have been taking nature very seriously. All that remains for me to say is thank you to Futera for hosting us, for giving us this gift of Solutions House. And thank you all. You've been marvellous. Thank you so much for your continued commitment to this coalition.